Hi, this is Linda Vincent, and I wanted to do my persuasive YouTube video for communications class. Today I am looking to start mine on medical marijuana and the benefits thereof. I wanted to first just say that I am not a marijuana user. However, I do have a brother that is. He was diagnosed with leukemia when he was 13. At the time I was 10. From there, for the 5 years in which he could not make any decisions in his life, my mother made those for him. He went through radiation and chemotherapy treatments for those 5 years, undergoing bone marrows and spinal taps every 6 to 9 months. Every week we went in to get his platelet counts done, his white blood counts done, to make sure that he was not going through any form of issues internally, or if he was possibly going into remission. We went through remission several times through this course of those 5 years. I would have to say that my brother, through his teenage years, did find cannabis, and he started using it as it was medically necessary for him. At the time he was 13, he weighed 80 pounds. So you can tell by that he was lacking nutrients. He wasn't eating very much, and downright he was just sick. So what the cannabis did for him, and again, he was older than 13 at the time when he developed a use for cannabis, but it did help him with any form of nausea. It helped with any form of pains that he may have had, as well as to keep a healthy appetite in order for him to maintain nutrients in his body. I'm not saying it's for everyone, I'm saying that it's for him. There have been studies done, and from the inception of cannabis, it started in 2737 BC. It was founded in China, was the first recorded records of cannabis. It was used for psychosis agents, and it was used for rheumatism. From there, it was used for gout, for malaria, and for absent-mindedness, funny enough. It spread from China to India. It also spread from India to North Africa. From there, in 500 BC, 500 AD, it did spread to Europe. For that time period in the United States, in 1850 to 1942, it was used for labor pains. It was used for nausea. It was used for rheumatism. There had been 79 different studies done from one particular doctor. Her name was Penny Whiteley, and she was in the UK at the University Hospital there in Bristol. Randomized patients were used. Most of them were getting relief with marijuana for nausea, for lack of appetite, for chemotherapy. Some of them also have used them for HIV, if they're an HIV patient. Through this study, it was not necessarily done for that, however. Further than that, most patients were shown for improvements versus a placebo being used. Studies have shown that patients that are undergoing HIV therapy, that have Alzheimer's and have MS, have been known to have some forms of improvement. I'm looking to lose weight. It is also helpful in helping you to maintain your insulin levels if you are a diabetic. It had also regulated their body weight, their insulin production, as well as for patients that are fighting cancer. Again, it does help them with regulating how their appetite is suppressed through chemotherapy, and it, of course, as everyone knows, it gives you the munchies. So for that in itself is something that has been a benefit. It is also stated that it can be harmful if used in a responsibility, but it does help also with drug and alcohol abuse. It's a safer alternative. It has also been known to regulate seizures. It's been known to help heal bones faster. It can help with depression. So if folks are having one of those foggy days and they're just not feeling well, and of course we know most people that smoke marijuana get the giggles, it may be something that they may use for a mood stabilizer. I think it's pretty funny to watch. Again, I have not used it, but it's not to say that it could be used for anybody. There are treatments for ADHD that have also been linked to using cannabis. There is also treatments right now that everyone's looking at is for glaucoma. If you have glaucoma, run to your doctor. Most folks are going out and getting prescriptions for marijuana distilleries. They are growing fast, literally. It also helps improve your lung health. There is one particular thing that states that for chronic lung problems, it does help with emphysema. It can help with your anxiety, slows down Alzheimer's, help with MS patients, muscle spasm, eating disorders, and arthritis. Those with PTSD, God bless them, they can also benefit from having marijuana used. Of course, it's to make sure that we get it legalized in each state. So I hope that you're in agreement with me. It does help folks. It may help yours. It may help mine. But again, it should be legalized. I do believe that marijuana has its benefits to each person. It may not be for you, but it may be for them. Have a great night.